Alright guys, what's CHF? We all know it, we've all pitched it, but what is it really? Congestive heart failure is when your heart muscle doesn't pump blood as well as it should. Certain conditions, such as high blood pressure or coronary artery disease, gradually leave your heart too weak or stiff to fill the heart the way that it should and pump efficiently. So there's a lot of symptoms. You can have shortness of breath, fatigue, weakness, swelling. That's where edema in our legs. We can pitch programs like our lymphedema program. The rapid irregular heartbeat, that's something that happens to a lot of people. I personally have that, so I know what that feels like. What I have is called Wolff-Parkinson-White. It's kind of like AFib, except it's, instead of completely irregular, it's got a regular beat to its irregular rhythm. But Wolff-Parkinson-White, remember that one. It's called WPW. That's one that you don't hear a lot, but when it pops up, a lot of people don't know what it is. Again, it can lead to CHF if it's not taken care of. What can patients do when they're young, healthy? They can eat right. They can do those things we already know they need to do by exercising. But we don't all do that. And we know that's how you end up in these situations. But it is reversible. You don't have to die from CHF, although my own grandmother died from CHF. One of my best friend's mothers died from it. My own mother had CHF once after she had surgery on, she had an aneurysm. You'd think it would have nothing to do with it, but they had pumped her with so many fluids that she retained all those fluids and didn't flush them and ended up going into CHF. So they had to put her in the hospital on some Lasix or whatever it was to remove all that excess fluid, and she came back and she was fine. There's a lot of different things that can lead to it. You can have a virus that leads to having CHF, or tobacco use, irregular heartbeats we talked about, certain medications can cause it. There's a lot of things that can cause congestive heart failure. But while it can't all be reversed, it can be made better. That's why when we go in with our team, and we already know what we do, we know we're going in with the CHF kit. Amy, my girl, already did a video on the CHF kit and how awesome it is. We can use those tools and get them weighing themselves, making sure they're not retaining fluids, making sure that their Lasix or whatever they're taking is helping to get rid of those excess fluids. But obviously the patient also needs to potentially lose weight or maintain their weight, whatever it may be, and those can help alleviate those concerns. I'm going through my list of things I wanted to talk about. Please look at the little PowerPoint presentation I sent to you guys, because there's a lot of valid information in there. But the one big thing I wanted to point out is that doctors who generally see CHF patients, obviously we know that's going to be the cardiologists and PCPs, but talk to them. Don't be afraid to ask doctors. Let them know about our programs, but see what they're doing. Maybe we can learn from them. But remember that the physical therapy is going to help get them moving again. The occupational therapy is going to help conserve the patient's energy. That's a huge deal. When it takes 20 steps to get across the room and they can barely do 5 without being short of breath, that's a big deal. Make sure that whatever gifts you're taking to those doctors' offices for in-services, be smart about them. Don't take them candy. I know we want to. It's easy. You just go in the store, grab a bag of candy, and everybody loves candy. But guess what? They're doctors that are seeing this problem time and time again. So maybe give them things like berries, flaxseed, oatmeal, dark beans. Well, maybe that's not a great gift, but if you're taking a lunch, you might want to do something that has a side of beans rather than a side of French fries. You know, just let them know we're thinking about what they're thinking about, and that we care about our patients as much as they do, if not a little more. All right, that's my take on all this.